Well, namaste, welcome back to my channel. In this video, I will explain the another important topic from gynecology, that is Asherman syndrome. Asherman syndrome is the short answer question for university exams. It is also very important for PIT also. What is Asherman syndrome? What happens in Asherman syndrome? See, in uterus, adhesions will be takes place. First point, that is called intrauterine adhesions. This is the uterus now. In uterine, adhesions will be takes place. Adhesions will be takes place, and endometrium is also present now. That is, that undergoes thin and defective endometrium. It undergoes thin and defective endometrium. Two present. About endometrium, thin and defective, it leads to intrauterine adhesions. These are the 2 points comes under the Asherman syndrome. So, what are the symptoms? Because of endometrium is not there, thin and defective endometrium, so menstrual abnormalities can be seen. In specifically menstrual abnormalities, specifically because of thin and defective endometrium, we can see specific symptoms like infertility, most common, next secondary amenorrhea, next hypomenorrhea, because it is thin endometrium, so shedding will not takes place, so it is hypomenorrhea, secondary amenorrhea, infertility is most common. Overall, this menstrual abnormalities are most common group of symptoms present in the Asherman. Asherman means intrauterine adhesions and thin and defective endometrium. Next, not only secondary amenorrhea, because of this dysmenorrhea and recurrent abortions will also takes place in Asherman syndrome. Next, causes. What leads to adhesions? Why adhesions will occur? Because of curettage. Because of after postpartum, if there is excessive curettage, if you're done, it leads to intrauterine adhesions. And after DNC also, dilatation and curettage. Next, because of cystosomiasis and removal of, when the retained tissue in the uterus is removed excessively, it leads to intrauterine adhesions. And last one is genital TB. These are the most common causes for Asherman syndrome. Most common cause is excessive curettage, next DNC, next cystosomiasis, and removal of retained tissue and genital TB. So, what are the investigations to be done? First investigation is TVS scan. TVS are hormonal test. Hormonal test means if endometrium is not present, means estrogen will not be present, progesterone will not present. So you can check those levels. And first is TVS scan. TVS scan, there is check the TVS scan means it tells about the endometrium thickness, all this now. So first investigation, TVS scan or hormonal test. Next, screening test. Beef screening test means HSG, hysterosalpingography. In this hysterosalpingography, check the uterus. Uterus is it appears as a moth-eaten appearance, something eaten by moth-eaten appearance. See, in center there are irregular filling defects, multiple filling defects, and irregular outline also irregular present outline, and along with multiple filling defects are also present, so it appears as a moth-eaten appearance. Okay, moth-eaten appearance. Same screening test when we done in like fibroid, HSD. Same screening effects in fibroid or any polyp, something HSG. But here same irregular defects only, like single filling defect. Here multiple, no, here fibroid polyp, single filling defects. And but in Asherman's this is irregular margins. Here clear cut margins, like smooth margins are present in fibroid. This is the difference between fibroid and the Asherman syndrome. In HSG screening test, okay, irregular margins and multiple filling defects is called moth-eaten appearance. Then diagnostic is hysteroscopy. Hysteroscopy means when we using the hysteroscopy, we can easily see what are the adhesions, where adhesions are present, and we easily see. So it is diagnostic and therapeutic is hysteroscopy. Screening test is HSG, and first test is TVS and hormonal test. Next, so what are the hormones? What are the test? Means first you should check the UPT test. Because they are coming with the thin endometrium. Thin endometrium means there is no menses now. So secondary amenorrhea will come now. All this can be seen, menstrual irregularity. So when we check the UPT, if any UPT test is positive, so in Asherman's UPT test is negative. Next, LHFHS, all are normal. LHFS is normal, estrogen normal, prolactin normal, THS normal, all are normal. But here effect due to endometrium, uterus. In uterus there is effect. In uterus there is effect because endometrium is not present. Estrogen is present, progesterone is present, prolactin is present, FH is present, LH is present, TH is present, but progesterone challenge test is negative. Progesterone estrogen withdrawal test is negative. Because if we given a progesterone estrogen withdrawal test, there is no endometrium to shred, so progesterone challenge test is negative. First one, progesterone estrogen withdrawal, here defective in the endometrium. If we given estrogen, there is no thickening of endometrium will not occur in this case. So progesterone estrogen challenge test is the withdrawal test is negative, challenge test is negative. These two are important tests because in Asherman syndrome there is defect in the uterine endometrium of the uterine, not at any hormones, okay, only at the uterus, only at the uterus. So progesterone test is negative, progesterone estrogen withdrawal test is also negative. So first you should see the hysteroscopic additional lysis. Additional lysis means cut the adhesions, intrauterine adhesions. First you cut it. After that put the Foley's catheter to prevent readhesions. To prevent readhesions, intrauterine insertion of Foley's catheter you can put. After that, estrogen, progesterone, both estrogen and progesterone give OC pills like 3 months to build endometrium. To build after this additional lysis, after cut this additional lysis and put the Foley's catheter, after that only you can give OC pills. Then it will recover, build endometrium. All will occur in this Asherman syndrome. So this is the Asherman syndrome. First point, Asherman means adhesions. Adhesions in intrauterine along with adhesions, not only adhesions. Endometrium is thin and defective. This is the important point. Based on this, you can write everything. First symptoms, menstrual irregularities, infertility, secondary hypomenorrhea causes because of excess of curettage and DNC. Histosome is removal of retained tissue and genital TB. First investigation is TVS, hormonal test, HSG, and diagnostic tests like diagnostic and therapeutic hysteroscopy. So UPT, all these are normal only, but progesterone challenge test and progesterone estrogen withdrawal test is negative. So hysteroscopic additional lysis. After that, to put the Foley's catheter to prevent readhesions. After that, only 3 months give the estrogen progesterone therapy to build endometrium. This is the Asherman syndrome. This is a short answer question for university exam. Please read thoroughly and write in exams. Thank you. Please subscribe my channel. Please support us. Thank you.